Hey, I'm Neurosurgeon Kazu.
In Japan alone, over 40 million people live with chronic headaches. It's so common that many simply accept it as an unavoidable part of life, choosing to silently endure the pain day after day. But the medical field classifies the vast majority of these cases as primary headaches. This means there is no underlying tumor, hemorrhage, or secondary disease causing the problem. The headache itself is the primary disease. We are going to address this systematically. Over the next few minutes, we will build your personalized 4-step headache relief action plan. To start, open a blank note on your smartphone or grab a physical pen and paper. By moving away from passive suffering and adopting a systematic tracking approach, we can turn a recurring affliction into a solvable medical equation. Step 1 is a baseline classification exercise. Think of this as a working hypothesis to bring to your doctor, not a final clinical diagnosis. Look at this diagram. If your pain usually pulsates right here, around the temples and eyes, and gets noticeably worse when you move around, you may be looking at type A, a migraine. This type often comes with sensitivity to light and sound, or visual auras like jagged, flashing lights. Now, if the pain feels more like a heavy, tightening pressure, squeezing the back of your head and your neck, you might be experiencing type B, a tension headache. This is the most common type, frequently linked to prolonged desk work and poor posture, though the pain typically remains stable even if you move around. Finally, if you face a severe gouging pain isolated directly behind one single eye, you could be looking at type C, a cluster headache. This pain is intense enough to cause tearing, and it usually hits daily for a concentrated period of 1 to 2 months. Based on these descriptions, note down which type, A, B, or C, most closely aligns with your recent experiences. This is your starting point for a professional consultation. Accurately identifying the geographical origin of your pain is your first defense against widespread misdiagnosis and ineffective generic treatments. Step 2 is setting up a daily tracking system designed to identify the hidden environmental or biological triggers that set off your specific pain. In your notes, create a simple table with these 5 columns: date and time, pain intensity on a scale from 1 to 10, medications taken, weather and barometric pressure, and menstrual cycle. You are looking for patterns that might seem unrelated to your head. Triggers can include the sudden release of stress, incoming rainstorms, or even specific foods like aged cheese and chocolate. Consistently logging this diary changes the dynamic of your medical care. You move from offering a vague complaint to providing actionable, quantitative data that improves a physician's diagnostic accuracy. Step 3 requires a mental audit of how frequently you rely on over-the-counter painkillers to get through the week. Watch this calendar grid. If you are taking painkillers for 10 or more days out of a single month, you cross a threshold that actually triggers a secondary condition. This feedback loop represents medication overuse headache. Excessive use of painkillers causes your brain to become hypersensitive to pain, creating a cycle where the treatment actually causes the next attack. To manage the pain without pills, apply physical fixes based on your classification. For type B, tension headaches, execute headache gymnastics, large shoulder and neck stretches, and soak in a warm bath to force blood flow back into the tightened muscles. For type A, migraines, your fixes are behavioral. Strictly regulate your sleep schedule to avoid weekend oversleeping, and maintain consistent hydration and regular meals to prevent low blood sugar from acting as a trigger. Combining these targeted lifestyle adjustments with a commitment to detoxing from over-the-counter medication breaks the cycle of chronic pain. Step 4 is mapping out a specialized medical facility. For chronic primary headaches, a standard general physician is often insufficient. Open your Map app right now and search for one of 2 specific terms: neurosurgery or headache outpatient clinic. When you go, you need to know what to ask for. If your diary points to migraines, ask your specialist about triptans, which target the nerves directly for acute pain, or the newer monthly CGRP injections, which work as a preventative measure. If you tracked tension headaches, inquire about a combination approach, using muscle relaxants to loosen physical tightness, paired with anti-anxiety medications to address the underlying stress. And if you mapped out cluster headaches, standard pills will fail. You must request sumatriptan self-injections and home oxygen therapy, which are the specialized treatments for this specific pain. Walking into a specialized clinic armed with this exact terminology shifts the power dynamic. It allows you to advocate for a structural cure rather than settling for generic pain suppression. Look at the system you now hold in your hands. You have a baseline target diagnosis, a formatted tracking diary, an audited medication plan, and a designated specialist near you. Your job now is to execute. Make your very first diary entry today and call that mapped clinic to book your appointment. Let us know in the comments below. Based on the symptoms we covered, which of the 3 headache types do you suspect you have? Headaches are a controllable medical condition. With proper diagnosis and this precise action plan, a clear, pain-free life is entirely within your reach. If this guide helped you, please like the video and subscribe to the channel.